Hello family, today let's talk about the role of ultrasound in managing ovarian cysts. Let's define what ovarian cysts are. Ovarian cysts are just growth or lesions which are found in the ovaries which are fluid filled, and most of the time they're not cancerous, they're non-cancerous. Some of the signs and symptoms that you might be feeling to think that you have ovarian cysts could be low abdominal pain, it could be irregular menses, it could be lower back pain. All those symptoms, once you have them, you might think that you have ovarian cysts and you'll go to the hospital. What we'll do something called a pelvic scan. And once you are told to do a pelvic scan, we'll do a pelvic scan just to examine your pelvic organs to make sure that all organs are okay. Some of the preparation could include, maybe you'll be told to fill your bladder, to take enough fluid just to fill your bladder, so that at least a full bladder will help us to visualize the organs in the pelvic region. Or sometimes, if not possible, we might be able to do a transvaginal scan, which does not need the preparation of you filling the bladder. So what are we going to see on ultrasound? A normal ovary, if it's normal ovary, we'll just look at the follicles are going to be there, we'll measure the size, and the size is going to be fine. But if there's a cyst, we should be able to see a hypoechoic lesion which is in the ovary, and we'll be able to measure the size to see how big the cyst is. And sometimes you'll also want to look at the components inside the cyst. Are there any other components like echogenic lesions, like septations? We should be able to look at them and make sure that they're not there. If they're there, then we'll be able to categorize the cyst to see if it's simple or if it's complex cyst, so that at least we should be able to communicate these to the team of clinicians and doctors who are attending to you at the hospital. So again, what we also want to look at, this cyst, this lesion or this cyst, is it bleeding or is not bleeding? If it's bleeding, then we'll categorize it as a hemorrhagic cyst. Again, we want to look at the pelvic region, just the pouch of Douglas, to make sure that there's if it's bleeding, it's not spitting blood in the pelvic region, it's not spitting blood in the peritoneal cavity. Or sometimes, again, you will see fluid in the pelvic region, just free fluid. Maybe it's just normal fluid or normal serous fluid from the cystic lesion. Again, you will want to look at the ovaries to make sure that there's no torsion, because sometimes one of the major side effects of ovarian cyst is sometimes it causes ovarian torsion. So we want to look at the ovary where the cyst is. We want to make sure that it's not enlarged. We want to make sure that the blood flow in that ovary is okay. We want to make sure that it's not inflamed, because if it's inflamed and there's no blood flow in that ovary, most of the time the cyst has caused what we call torsion. And sometimes, again, if it's just inflamed and with increased vascularity, most of the time the cyst could have caused something called arthritis or inflammation of the ovary.